and welcome to another episode of Dietitians Dialogue. My name's Jamie Portnoy, your host. Today we have a very special guest, Josephine Gonzalez Chua. She is a physical therapist, and we are very excited to have her today. Hi, Josephine.
Hi, Jamie.
Thank you very much for coming today.
Thank you for having me.
Well, thank you. So today we want to ask you several questions, but before we get started, let us all know, why did you become a physical therapist?
Well, Jamie, it was just being a good girl and did what my mom asked me to do.
Well, that's a good thing then. We always want to do what our mom tells us to do.
Mm-hmm.
So you did what your mom told you to do, and you became a physical therapist. So what does it entail becoming a physical therapist?
Well, I tell you, it is a lot of hard work and it's not easy at all. Back when I did it, it was only a 4-year course, but now it's become more difficult to get into school, and it has become an entry-level doctorate's degree.
Wow. So there's actually a lot that you actually have to do to become actually a physical therapist. So what exactly do you do on a daily basis?
Currently, I'm doing outpatient physical therapy. So I treat a lot of patients who actually have pain issues, especially chronic pain, and they come in with problems that they may have had for years and could not have any relief from that.
Sure.
And I help them learn how to do some exercises to help them stretch or relieve their pain themselves or manage their pain.
Wow. Okay, so very good. Very, very good. Now, with that, we're going to get to exercises in just a couple minutes, but before we get to the exercises, with being a registered dietitian, there's several different jobs that one can do. One can go into a hospital setting, one can go into an outpatient setting, one can even go into a nursing home, one can go into, a food service setting type like a restaurant, or even, a cafeteria. So there's a whole wide variety of different things that a registered dietitian can actually do. But how about a physical therapist? What are the different jobs that one can do after, completing their degree? What can they do?
A physical therapist can be in any in any setting that may be outpatient. Okay, could be sports medicine, athletics. Could be with the hospital doing inpatient bedside acute therapy or orthopedic post-joint replacements, or it could be a nursing home as well. And they could work at schools to work with kids who have problems with orthopedic and urologic issues.
Oh, wow. So there's actually a wide variety of different jobs that one can do also. So just like a registered dietitian, a physical therapist can do different jobs also. So you said you work in an outpatient setting. Did you have other jobs that you did prior to doing an outpatient setting?
Definitely. Since there's a big variety of things that you can do in physical therapy, I wanted to gain experience across the board so I would know exactly where I wanted to be. So I actually started in a hospital, and they offered me the ability to be flexible between inpatient and skilled nursing, and I was also able to do nursing home consultations and actually home health care as well.
Wow. So, and then after that inpatient setting, is that when you decided that, oh wow, you've had so much experience here that you kind of want to go on to this outpatient setting type?
Definitely. I wanted the fact that the patients could walk in the clinic and I would treat them, and they could walk out and go home and know that they're doing the things that they would love to do.
Sure. And also, I bet, same thing too, with an outpatient setting, you're seeing more of the patients and you're following up with them more regularly as opposed to inpatient, and you're probably not seeing them more regularly as well.
Definitely.
So exercise, I know that you mentioned that as an outpatient setting, you're seeing the patients and you're doing exercises with them. Can you give us some exercises or stretches and go in a little bit more detail with us what you do with patients and elaborate a little bit more on that?
Okay. Most of my patients have pain, and part of their pain comes from postural problems.
Okay.
And because they have postural problems, they usually have muscle imbalances. So I would start them with gentle core stabilization exercises that would increase the strength of the inner core. So when I give them exercises, I usually start them with a gentle core stabilization exercise. So activating transverse abdominals especially, and multifidi, just because we want to gain strength and stability of their postures first, and improve the muscle balance by giving them flexibility exercises for the spine and lower extremities that they can do at home so that they can start getting better.
Very good. And then how about, do you provide them with homework? Do they have to do specific exercises? What are things that you provide them to actually buy? Give us some examples of things like that.
I do give them exercise handouts.
Okay.
Okay, and sometimes if it's very specific and modified to their problem, then I actually would take maybe a picture or a video for them to take home, and if they have a phone, of course, I would send that with them. I would also suggest certain equipment that they could buy, simple ones, such as like a stretch out strap that you can get from Amazon.com, or give them elastic bands, and also suggest certain DVDs that I know some physical therapists have developed so that they can actually do exercises that are safe for their condition.
Sure. And so with a lot of stretches, comes in proper nutrition. So with proper nutrition, eating a balanced diet and making sure that we're staying hydrated is going to be very important. So, that's going to come into play hand in hand with actually staying hydrated and eating a balanced diet with, doing those stretches. Do you ever say anything on nutrition or recommend them to see a nutritionist?
Oh, definitely. Especially with patients who have chronic pain issues. Actually ask them to see if they could meet with a nutritionist to help them with their diets, especially with bowel and bladder issues, which is my specialty. Mm-hmm. And so I would ask them to drink proper, adequate fluids.
Sure.
And none of the bowel bladder irritants that they may have. And I would also suggest to them that by seeing a nutritionist or a dietitian, they would understand what foods or fluids that they're allergic or sensitive to that may be making their problems worse.
Sure. Bladder irritants are going to be things such as caffeine, which is actually a diuretic, artificial sweeteners, and then it's going to be things such as acidic foods, and then anything else that is going to be spicy foods, and I think the list can go on and on.
Definitely.
So, Josephine, I want to ask you, what have you learned from becoming a physical therapist?
Being a physical therapist, it's really a gift to be able to work with people, and everyone is different, and you have to tailor their physical therapy plan of treatments according to their needs. And you have to understand where they're coming from and where they want to go.
Sure. Very good. And where do you see yourself in 5, maybe 10 years?
Well, I'm hoping by then that my private practice will be successful, and hopefully maybe I will have maybe 1 or 2 people under me who will be dealing specifically with the specialty that I'm in, and hopefully also be comfortable with my kids, growing up in college.
Sure.
Or hopefully done with college by then.
Well, that's a big goal. So I wish you a lot of luck. And what about, well, that actually is obviously goals and where you do see yourself in 5 to 10 years. So I just want to say thank you very much for coming on. We really appreciate all of this wonderful information, and we hope to have you on again.
Thank you. Thank you, Jamie.
Remember, if you embrace nutrition, nutrition will embrace you. This is your show. I want to hear what you have to say. Like me on Facebook, follow me on Twitter, email me questions or show ideas. Have a great day.